Thank you all for coming. You're probably trapped here because of the weather. I'm talking about direct primary care, and I'll start from the beginning in case you haven't heard of it at all. I do direct psychiatric care. I'm a physician, an MD, but I don't do primary care. I do psychiatric medication management. But everything's the same other than just the work I do. I'm here all afternoon and evening if you have questions about this that I don't get to, or other areas I'm interested in, or medical marijuana, the Death with Dignity Act, which is kind of the tentative title for Minnesota's aid in dying legislation, or any other kind of topic where medicine and liberty interact.
You need a checkup.
A checkup. So the current state of healthcare is bad. Basically, when there's time or quality or cost, they're all worsening. Doctors are not happy either, the ones I talk to. The patient load is huge. The wait time is steadily increasing. If you do get in with your doctor, you might have 8 minutes. Half of that he or she is looking at a computer, typing away. There are costs, which are significant. The patients, this is kind of small, but basically the bottom two lines are inflation and wages. The top two lines are deductibles and premiums. And at some point, no matter what numbers you start at, if your healthcare costs are increasing 15 to 63%, but your wages by 11, eventually you're only paying for healthcare, and that's, that you can't live that way. Cost to employers, there's a bunch of costs that the employer can say, yeah, I had to write out this check to this insurance company. But the huge hidden costs are people not going to the doctor, having to take 4 hours off for, like I say, an 8-minute appointment, missing a whole half day of work. A bunch of opportunity costs and hidden productivity costs. And the reason why it's so bad, it probably doesn't surprise many of us. There's no, really since the 40s, 50s, 60s, no market in medicine. I'm a physician. I've been in my office and somebody's asked me, how much does it cost to see you? And I have to honestly answer, I have no idea. I mean, I know now roughly, but who's your insurer? Do you have an insurer? How long will we meet? Or even there's all these perverse incentives and hidden motivations, and so I don't have an answer for that. And we often, for years, couldn't answer how much is an EKG, how much is a cholesterol test, and only in the last few years is there actually, you can buy these things now if you want to. There's no incentive then to compete on any kind of cost, quality, timeliness. I think of when I was a resident doing moonlighting shifts, I would get paid the same per hour whether I slept all night or whether I was up the whole 12 hours in the ER dealing with psychiatric emergencies. And most doctors are altruistic. They want to help people, but even myself, when it's 3 in the morning and I could maybe sleep for a few hours and another patient comes in, it's tempting for me to even say, oh, for Christ's sakes, why didn't they stay home? That's terrible to have your physician think that. The customer pays so little of the cost of care, and often none of it at the point of service, that they don't care that an MRI is $3,500. They might know I only have to pay 10% of that. That's not bad. There's no driving down the cost. And the conflict of interest, until I opened my own direct pay clinic, my customer was never the patient. It's always the insurance company. And I have to think of things like, well, this year have I ordered too many MRIs, and is Blue Cross Blue Shield going to reimburse me at 55% instead of 60% because they think I'm overutilizing MRI? And then who's the next person who walks through the door that I think, well, maybe they need an MRI, but then the other part of me says, but that's going to hurt my bottom line. And I don't want to say that physicians are ever doing that, but when that's always behind in your mind when it shouldn't be, it can be dangerous. So this is just one solution, direct primary care. There are many other things out there, concierge services, I think religious-based health sharing organizations is another one. But this is basically an attempt to say to the patient, here are your costs, here's what's included, here's what you're going to have to get on your own, but we'll try to help you. It's usually a low monthly fee and has many included services. Your doctor gets back to working for you. So even if they aren't, if you want to assume the worst and they're not good-hearted, altruistic people, they still don't want to lose you as a patient. So if nothing else, they're going to try to treat you well to keep your business. And things that they can't do in office that are included in the monthly fee, they get very low-cost labs, medications, tests, because the equipment already exists. And if it's not being used for insurance-based purposes, most ultrasound groups will say, yes, we've got 4 hours extra, send us up to 50 patients a month, and here's their cash price. And it's often single-digit percentages of what the real cost is. MRI, $3,500. You can negotiate with these places for $300 to $500. Medications that are $600 a month can often be $600 to $60. It's really huge savings. So 2014, there are 125 direct primary care locations. And then just to kind of, I'll go back and forth. The next one is about 3 years later. It looks like an infection map, frankly, with these red centers. But so if you just kind of look, it's steadily growing. There's only 2 states that don't have any, North and South Dakota. And I think it's just they're sparsely populated. They have nothing against it, either written in the law or culturally, I guess. So direct primary care, everybody jokes why you can't reach a doctor, you can't ever talk to your doctor on the phone. It's because they will never get paid for it. If you don't have a face-to-face visit, due to rules back in I think the 50s or 60s, there's no way to bill for it. So a doctor can spend 10 hours one day doing email, phone, and all this stuff, and there's no way to bill Medicare and most other insurances for it. But if you're, let me jump down to the bottom. So these are what the monthly fees are like. This is just a group, age-based usually. I mean, for me as a psychiatrist, I don't do that because it's not any harder to take care of the mental health of a 75-year-old than a 15-year-old. But a lot more medications or procedures might be needed if you're a primary care doc doing medical care. So it goes up, $39 to $69 a month. Some places will do, your whole family is $180 a month. And you get more contact but fewer visits. The perfect example is I'm gardening, I get a rash, I can take a picture of it, text it to my direct primary care doc and say, look, I think this is poison ivy. He or she can email back or text back and say, yeah, just use this salve, it's over the counter. If it's not better in 3 days, text me another picture. So I'm getting all this care for what takes half a minute for me and even less time for my doctor. And saves my doctor's time so that he can spend more time with somebody who just got out of the hospital after a heart attack and has 15 new medications they need to manage. So crunching the numbers, I couldn't believe this when I first heard of it. In 2010, I was in DC with a group of doctors trying to talk with legislators about Obamacare. And I went Segway touring DC with guys who were starting this. And doctors make 30% more, patients pay less, insurance companies save money, employers save money. And the question is, how can that possibly be? I do get to that, but one example is when I used to work in a clinic as usual, one patient visit, once I got done with that documentation and everything that I did in that visit, it went on to 8 other people who then spent another 10, 20 minutes doing whatever they do with it. So, and they're all getting paid, and so am I. And so a standard clinic, you've got 8 people involved in a patient visit, where a direct pay clinic, 1 to 1.5 people involved in any given visit. And when you're in a standard clinic, there's no incentive to manage things outside the ER or the urgent care. It's, if I'm too busy and I got somebody who says, you know, I think I broke my ankle, I might say, fine, just go to the urgent care, because it doesn't matter to me or the patient. But if I'm less busy, I can try to avoid an urgent care or an ER visit, saving the system thousands of dollars, which incidentally would pay for a decade or two of direct primary care. So just following a $1 charge, in a standard clinic, you charge $1, the insurance company never pays $1, they pay 60%, sometimes zero if you do the documentation wrong. Your overhead to get that money out of the insurance company is another 60%, so you kind of get, you know, a quarter and a dime out of your work. Direct primary care, you charge $1, they're paying you $1 because they know the fees. Really the only overhead is a credit card charge. There still is kind of 10 to 15% staff overhead, but if you're doing EKGs or dispersing medications, you can recoup the cost that way and still keep the prices really low. What is covered? Unlimited visits, home visits importantly. Myself, I see group home patients. Some of those seriously mentally ill are in group homes. When I worked in a regular clinic, I couldn't even walk across the street to go to a group home and see a patient because the insurance wouldn't pay for it. Just entirely ridiculous. Here I can drive to the group home, and because they're paying me per month, they don't care whether I meet a Starbucks, my office, their group home. Email, texting, phone calls, Skype, it's all allowed. Anything you can do in-house, stitches, mole biopsy, skin tag removals, casting of fractures, it's all included when you're doing a direct primary care. And here's just some numbers of the studies I was telling you about. Lab work that's $90-some roughly, you can do it for $3.25 at a direct primary care. And I get to why you can do this later. I won't talk about it much, but surgery centers are even popping up where they take direct payment and they don't do insurance, and they can save thousands because there's all these regulations and rules you have to follow for Blue Cross to pay anything that you've done. But you can get rid of all those if they don't make sense for patient care. How can it work? It seems ridiculous that all this savings could happen. I've done paperwork where there's 12 pages of insurance company mandated paperwork to get a wheelchair for a man who's missing both legs above the knee. So, you know, it's ridiculous that, because that takes me, let's say, 45 minutes. Somebody at the insurance company, you know, God help them, needs to read that, and then somebody needs to decide, well, will we get this poor guy a wheelchair or not? So all the inefficiencies. I've had to counsel people on smoking cessation who are paralyzed and can't move and couldn't smoke if they wanted to. I've had to counsel people on seatbelt use when they're in a group home, they have a guardian, they can't not use a seatbelt. Just ridiculous inefficiencies. That example of, have I ordered too many MRIs? Am I going to get docked for that? And when I was in a standard clinic, I was just a very highly paid transcriptionist. I typed like a maniac every day. You know, tried to look at my patient, tried to pay attention to them, but it's just me typing so I can go home maybe 2 hours past my shift instead of 4 as I sit around and wait, do more documentation. Paperwork mandates. So again, how can it work? Insurance is kind of the wrong tool for the job. It's an overused example, but car insurance, if I tried to sell you car insurance that, and I told you, you know, you can only fill up 7.5 gallons at a time, you can't ever go to Super America or Quick Trip, and your car insurance has to cover these 3 bizarre things that'll never happen in Minnesota, you know. That's how medical insurance works. There's all these requirements. And the purpose of the visits and the note changes. I can write a 1-page note that's useful to me, the patient, and any future doctors, but isn't a 7-page thing to try to get money out of the insurance company. Again, cost savings. Some of these places can get medications cheaper than Walmart can. And why did it happen so late? doctors are not taught anything about economics or managing a business in medical school. It's just terrible. Whenever somebody would ask, it's always, well, whatever clinic you go to, they'll teach you how to bill. And then they never tell you anything about running a business. And the other part is a lot of these places, Airbnb, Uber, they weren't spurred on by, they were probably hindered by the companies they were competing with. And I think that's happened a lot behind the scenes with insurance companies. Electronic medical records are just so user hostile that I think that's another thing that really got this stuff going. Not many risks. I mean, there's a chance the government will outlaw it because it is, a type of freedom. But it's protected against in about over half the states. You still need a catastrophic coverage because if you get cancer or you get into a huge accident or you sever off your hand, you're not going to go to your primary care doc and fix those things. You need to be able to pay for a hospital stay. So you get something like a high deductible catastrophic insurance plan that'll cover millions of dollars of cost if the worst happens. Possibly a doctor shortage, but if they're getting paid more and they're happier, more will go into it. So any shortage, I think, would just be 4 to 6 years as the medical schools realized, oh, we should send more people to primary care because it's enjoyable, it's reimbursed, and so they're going to start ramping up production. This is my last slide. The future, the great thing.
Last slide, I see one more.
That's right. It's the future would be great because this is just one model. These other ones will compete with direct primary care. And even better, let's say somebody opens a psychiatric clinic across the road from me, and instead of $45 a month, they're going to try $40 a month. Have at it. I mean, let's drive the cost down, then I have to compete. I either provide a better service or I drop my price. And the free market will just work with this as it already has. Again, I have time for questions. If you want to know more about how I do it, which is mostly what I've talked about, happy to talk about that too. Yeah.
How does your model go about integrating alternative medicines and or similar modalities that don't necessarily deal with prescriptions or an actual, like it's a layperson's job versus someone who's gotten a PhD in medicine or something similar to that, like a massage therapist or acupuncturist or
Sure.
naturopath?
It's I'm from the Mankato area, and one of the main naturopaths down there uses supplements. He doesn't take any insurance either, and he just charges directly per visit. So they're already charging a great deal of money. So if they happen to move to this, it would hopefully just be more savings. I don't know of many non-physicians using this, although there's a talk therapist who's starting up something like this, and it'll work, I think, from what he and I have talked about.
So I know you touched on it a little bit, but with the direct primary care, you would pay so much per month, and then you talked about the catastrophic stuff.
Right.
So, like, what are the costs for those? Do you know? Do you have, like, ballpark areas, or where would you, are there any, like, direct primary care ERs or urgent cares?
No, there are some surgery centers, but for planned surgeries. So basically you would still have the high deductible, let's see the phrase, high deductible healthcare plan, but if the insurance company knows that they aren't going to have to pay for stitches, casting, joint injections, and all this, instead of it being, let's say $5,000 a year, it may be $1,250 a year. So you're still going to have to pay for the insurance plan, but hopefully it's a lot cheaper once people realize the savings. Yes?
Direct primary care, can you pay with health savings accounts?
In some states you can. I don't think in Minnesota, but I think the insurance companies, when they see this and how much they save, they're going to say, yeah, send us your annual bill or your monthly bills, and we'll reimburse you 75%, you still pay the rest of it. But I think it'll come around to be used by that.